Great, thanks, Suzanne, and thanks for everyone for being flexible on our schedule here. You'll note now we sacrificed our second break, we're going to plow through here. You'll recall that we did a poll question, right, before that last session, and we asked you if you could double the investment in your state, what would be the impact on recidivism? And great response rate. Just about everybody in the room responded. So we have a pretty effective sample, I think, of everybody here. Great optimism and confidence across the room. You can see that folks here overwhelmingly are pretty confident that there'd be a significant impact in recidivism. In fact, nearly a 20% reduction. Right. So we here like to share your optimism and are certainly want to see the same kind of impact. Let's keep in mind, though, right, what we just heard from our Texas panel, which really demonstrated that it's clearly not just about resources. Resources clearly are a factor, but resources alone, right, aren't necessarily going to make the difference. And so with that, we want to now have a discussion with people who really represent a cross-section of different states across the country, and then we're going to open it up for questions that you may have or points you want to make based on what you've heard so far. I'm thrilled to introduce this panel, which includes people who are not only leaders in their states, but also leaders nationally. First, Susan Burke is the head of the juvenile justice system in the state of Utah. She's also the president of the American Parole and Probation Association. She, together with our other panelist, Candace Jones, who's the head of the Illinois Juvenile Justice Department, are very active and leaders in Ned Loughran's group in the Council of Juvenile Correctional Administrators, an exclusive club of all of the people who run the juvenile correctional systems in the country. So Directors Burke and Director Jones, thrilled to have you with us. Also very pleased to have Justice Bridge with us from Washington State, who's the CEO for the Center for Children and Youth Justice. She's from Washington State, but a real national expert on bringing the courts into all this and making sure that the courts really have what they need to actually implement a lot of what we're talking about. And then at the end of the table, Representative John Tilley, who is the chair of the Judiciary Committee in the state of Kentucky. Dr. Garducci mentioned earlier the great partnership with the National Conference of State Legislatures and what they're doing in this topic. And Donna Lyons, I think, is here somewhere. But NCSL, great friends of ours, and Representative Tilley, the chairman of the Law and Justice Committee at NCSL. So a terrific panel. We're going to have a pretty interactive discussion. And I just wanted to start, Representative Tilley, with you, if you don't mind. You're in one of those states that, like those blue bars, right, really pushing the population down. So if you can just give a quick recap of Kentucky's efforts to reduce the juvenile justice population in your state.
Well, I can do that quickly. Are you sure about that? Well, in Kentucky, it's been often said, as Mark Twain once said, he wants to die in Kentucky because everything there happens 20 years after it happens everywhere else. Except with juvenile justice and some other reform efforts we've made in drug policy, et cetera. So I take great pride in that. But I say that to say that it's not typically our role to lead in this area, but I think we have, thanks to states like Texas. It's easy to use Texas as the lead in any discussion. So I do thank them as well. And my friends, I started the adult criminal justice reform with Jerry Madden years ago, and he was an invaluable friend as TPPF, you all know, in the Right on Crime movement. I happen to be a Democrat in what was a purple state, which became red on Tuesday. If you actually saw, I see a lot of nodding heads. My colleague, Senator Whitney Westerfield, is here, and I want to give him kudos because he actually sponsored our bill, which is in its infancy has showed some tremendous results. So briefly, I will say that we embarked on this. We took a 2-year process, essentially, with a task force, Mike, very, again, interbranch, a very bipartisan group. Every stakeholder was represented, every group that had a voice in juvenile justice, from mental health to schools, to prosecutors, to defense counsel, was involved in about a 15 to 16 member group. The first year I had a less than willing co-chair, and we did not get much of anything done. The next year, Senator Westerfield joined me. He saw the need for this. He saw the numbers, which just jumped off the page, and we were able to use those facts, as Senator Whitmire said a number of times. You can't avoid the numbers, and essentially that's what propelled us. And again, in Kentucky, we had a House controlled by Democrats and a Senate controlled by Republicans, but we came together on this issue in a very nonpartisan way, and I'm, again, proud of that. What we saw that drove our effort was a number of low-level, over half of our children again, incarcerated. We can call them detention centers. That always sounds too much like the Breakfast Club to me. It looks like a library on a Saturday morning. That's not what detention is, right, for our juveniles. We have razor wire involved. So what we had were half of those who were in there because of probation violations and misdemeanors. We also had a high number of status offenders. I think Oregon and Texas at one time were leading the charge on that. We've brought those numbers down significantly. We also found that we were spending an inordinate amount of money on this. In Kentucky, over $100,000 a year per bed, and again, sending far too many in our Child and Health Family Services cabinet to out-of-home placement as well. We were sending a number of low-level offenders, almost 100% of them went immediately to an out-of-home placement rather than being kept in the community for resources. We passed the bill in 2014. It did not become live, it did not become effective until this summer, July 2015. But we saw an interesting phenomenon. We established a number of our counties got to work without the mandate. We now have 30 what we call fair teams in place, which are essential for the community efforts, again, handling that juvenile in the community. And we avoided an otherwise what would have been a really unfortunate acronym. We call them the FAIR team. That stands for Family, Accountability, Intervention, and Response. One of our Ivy Leaguers that was there to help us, nothing against those who went to Ivy League schools, I could never state that, but they mentioned that we should call the team the Family, Accountability, Intervention team. Think about that one for a minute. That would have been, well, you're not laughing, so you obviously haven't got F-A-R-T, okay? So now, I just thankfully I sped that up for you. And I'm the guy from the South. Having said that, we changed it to the FAIR team, thankfully. And I think in no short, well, I think you could allow, well, some of that success is due to a better acronym. We have 30 teams in place, 64 on the way. At the end of the day, we'll have 60 to 64, I think. Lori Dudgeon, our court administrator, is here. I think that's right. 60 to 64 teams, right, Lori? 60 on the nose. 34 now, 60. I knew I had a 4 in there somewhere. And let me tell you, what we've experienced is nothing short of phenomenal. We've seen the number of children that are now being diverted increase 70%. 70%. I had one judge tell me that I'm going to cancel one of my dockets. We're looking, I think, if our new governor-elect may have the ability to claim victory and close 2 juvenile detention centers. We've also had, as reports from our juvenile justice cabinet, we've had 60% fewer children being incarcerated. And again, no appreciable effect. In fact, we see no public safety impact whatsoever. And earlier, there's no detrimental impact to public safety. Mike, again, I don't know if you want me to go into the challenges of implementation.
Let me stop you right there, Representative. Thank you. I guess the next question I want to ask you is, I mean, you're where so many states in this room have gotten, which is to really congratulate each other on some extraordinary policy changes in the juvenile justice system and a dramatic downsizing of the system, right? Again, that's that blue bar chart that Suzanne showed earlier that so many states now share in common. The next question, the question that Texas is asking, so what are they getting in the community? What difference is it making? Are they recidivating? It doesn't sound like you're at the point yet where you have that kind of data. You said the bill had just gone live, right? We
don't have that data yet. What we are hearing is anecdotal. I'm hearing good and bad. Those are the numbers I gave you are, again, phenomenal. We're very hopeful that now the children can be handled appropriately. We will have good results in the community with these children. Kentucky essentially is, talking about Delaware, Kentucky is much the same way, but it's really 4 corners. You have the triangle, the resource-rich triangle, Lexington, Louisville, Northern Kentucky, greater Cincinnati area there. And then you have East Kentucky and Appalachia, and then the far west, which probably, again, has more resources, but, again, very different dynamics at play there. What we're hearing is those some of the same efforts, graduating these children at local efforts, and that's what the FAIR team is designed to do, essentially put control in the hands of our local folks, but at the same time, they have to meet certain state standards and certain mandates. In other words, they can't use programs that aren't evidence-based. We have a county incentives program, which that will be up and running soon if we can fund it in this year's budget, which will essentially incentivize them to use evidence-based programs, report on their results. The more results they can report, the more favorable outcomes they can report, the more money we'll give them to continue to drive these programs. So that's been essential. Recidivism, it's funny you mentioned that. We didn't know what it was. We were one of those states that you and I studied that didn't have any idea what our juvenile recidivism rate was. We're working on that. We'll have a report soon. Adult, yes. Juvenile, no. That's a problem. And we want to follow these kids from the juvenile state into adulthood as well, and that's the more longitudinal look we've talked about as well.
So thanks, Representative. Let me bring in our other panelists now. And by the way, there's an issue brief that was put out together with the Office of Juvenile Justice and Delinquency Prevention and the MacArthur Foundation that really shows just how few states, in fact, are measuring juvenile recidivism. And to the extent they are they following them into the adult system? Are they breaking it down by county, right? These are high bars that many states have yet to clear. Director Burke, let me now turn to you. We talked about a study that hasn't been done anywhere else. This is the study that was done in Texas. Utah, another state where you've seen the number of kids in confinement drop significantly. If we did the same study in Utah, what's your sense? Do you think we'd find the findings would be similar? That is to say, kids doing better closer to home, but not necessarily changes in recidivism?
I think you'd find that, yes, in Utah. And we've actually done a little bit of work in trying to identify what is happening at the ground level in Utah. We had a legislative audit of our particular system and found that 50% of the kids that go through our system are rearrested within the first year. And half of these kids are going into community residential placement programs. And so that really tells us that what we are doing out in the community and trying to improve our efforts to keep kids at home, it's not working. It's not working in the way that we want it to work. And one of the things that we have struggled with is the way that we had contracted for our community residential placements. These are private provider contracts, and we had indicated in our contracts that you will utilize evidence-based practices. But we know unless you clearly define it, unless you monitor, and unless you spend time actually working in the facilities and holding them accountable for those outcome measures, you're not going to see those results. And so we have just gone through a process of rebidding all of our contracts, strengthening the contract language, and we're also looking at different models for how we implement these residential treatment programs. We know that the research is pretty clear that if you continue to keep kids in these programs for longer than 6 months, you're going to get diminishing returns. And so we have implemented some short-term placements, but also requires a higher level of intensity. And I've heard a lot of discussion about changing models and then saving a lot of money. If we can keep these kids out of home for a shorter period of time, then the states are going to see this huge recoupment of dollars. But I'm here to warn you that if we want to have better, more intensive, clinically supported treatment interventions, we're going to have to put the dollars into making that happen. We're not going to be able to invest the same amount of dollars in these treatment programs and expect that we're going to get better outcomes just because our contracts say that you have to produce better outcomes. We need to have more dollars invested and then couple that with transition, aftercare, and intensive wraparound services for those families, because we know that once the kids leave that particular facility, that structured environment, sometimes they're returning home to a chaotic environment, and we need to be able to work with those families and the siblings in those families before that child returns home and then support that transition.
Thanks, Director Burke. Director Jones, play out for me a little bit the conversation that we're hearing in some places. Like, we've been moving heaven and earth just to totally overhaul our juvenile justice system. We've been so successful. And now you come in here and you move the goalposts on us. You basically said it wasn't enough just to sort of reduce the population by 80%. Now you're basically saddling us with outcomes that we can't be responsible for.
Right.
Fair observation?
Not fair. So I think the sort of ugly truth about me is I'm just a sneaky data nerd that somebody let in the back door. And the truth is, I think systemically is that the goalpost hasn't moved. We're just actually talking about it. This idea that you can have these systems, I was having with my team sort of a robust discussion about juvenile justice in Illinois, and should we be looking at recidivism at all? Is it because it's not a positive measure of youth outcomes a measure? I think the question around what we're measuring is, are we measuring anything? And while I do think we need to be measuring positive youth outcomes, we also got to measure those negative indicators, because they are a reflection on what we are or are not doing. The way we've looked at reform recently in Illinois is we've celebrated, thanks so much to the leadership of the team that I have here, some significant reforms that have reduced the number of youth committed. But I think there's this big second bucket that we all have to grapple with, which is there are kids who are always going to end up in the deep end system. And are we willing to step up to the plate and be accountable about their outcomes? I think if we're serious, not about just being tough on crime and rhetoric, but about being tough on public safety and recidivism, we're going to have to deal with that second bucket.
So let me pick up then on a theme that Director Burke raised about the contracts with providers, right? So we start to talk about the number of kids in confinement versus the number of kids under supervision, right? In Texas, we were looking at about 5,000 kids incarcerated, 70,000 kids under community supervision. That's where the volume was, right? Lots of contracts with local providers. One of the things I know that Dr. Fabella was constantly talking about was Texas measures performance. Whether people are actually using those performance measures, it was a lot of outputs. Are you providing this service?
Right.
Are you measuring this? Did you finish that? Kind of a thing. What about recidivism? So talk to me about actually going up to a provider, talking about a contract, and now you're contracting not just for a service provided, but for an actual outcome,
Right.
an actual recidivism. How's that conversation going with providers?
It's a tough conversation. It's a tough conversation in a state like ours that's not resource rich at the moment, right? Because in some ways what people are saying is you're changing the standard and you're not giving us anything extra to do it. But it's a conversation we have to have. We have been doing performance-based contracting in our state for a very long time. When I came in, I was like, somebody hand me these great reports about what all these different providers are doing for our youth. Nobody could even find them. Right? It's not just enough. We do spend a lot of time, money, FTEs, full-time employee time collecting all this data. One, we don't look at the outputs we're already collecting, and then to change the conversation, because what we're doing now is saying the same level of standard that we're holding our facilities, which I control directly, accountable to, I want our private contractors to have to produce those same outputs. If I say you can't put a kid into confinement in one of my facilities, I want to know what kind of restrictive seclusion is being used in one of these facilities. I want to know the recidivism rate for kids coming back who've been in part of these programs. It's a difficult conversation to
And
have.
is that data available, to be able to talk about what different outcomes different providers are getting, or is that just a whole step in and of itself?
The truth is that it's available for providers who have better resources. Some of our bigger shops are able to produce that data and have been producing it for a long time because they are getting resources from different state entities, myself, the Department of Children and Family Services, the Department of Human Services. But for smaller shops, community-based shops that haven't had the capacity to do that, it is really difficult.
Justice Bridge from Washington State, you've been a fantastic liaison to the third branch, which is so pivotal to all the things that we do here. One of the things
I prefer to think of it as the first branch.
The first branch, excuse me. Well played, well played. As a three-branch organization, I should have seen that one coming. And let me ask this question. You've been enormously successful. I mean, we don't come across people anymore who say, you know what, I'm not for evidence-based practices. Anybody you go to now, evidence-based practices, I'm for that, right? I mean, everybody's for evidence-based practices. The frustration that we often hear then is when you actually then get into the courtroom and the gap that occurs between what we talk about with evidence-based practices and everybody embracing it rhetorically, and then we actually get into the everyday practice where people have a lot of experience and they like to do things the way that they've done them because they feel that served them well. Can you talk a little bit about sort of that culture and what we're talking about and what that requires to actually change?
And with particular reference to that first branch of government, right?
Oh, yeah.
Okay. And to wit, judges who are a key part of juvenile justice systems as well as key parts of juvenile justice reform, and all too often a fact which is all too often disregarded when people get reformists in the room. I think that has shifted over the past decade, but certainly when I first was at juvenile court in the mid-90s, when we were worrying about super predators and what were we going to do with them, the judges were the last calls to be made rather than, as it has evolved, sometimes we're the first calls to be made, because when we engage in reform and we call the meeting, as they say, it's a cliche, but it's a cliche for a reason. People actually come to the meeting, and so you are able to get the kind of multidisciplinary groups of stakeholders, including providers, legislators who can sign the checks, the executive branch who can make the rules for engagement and whatnot, actually in the room to try to focus on that reform. So I think, but getting judges from having things thrown at them as opposed to saying be more engaged, be more involved, is it's really not the traditional view of the judiciary. We are not proactive. Cases come to us. We don't go out and grab our work. So I think there's a way, however, of engaging judges, and it's worked in the state of Washington and elsewhere, I'm sure. But the first is to address that fear of data, that fear of, well, evidence-based practices, but what does that mean? I know what works. I have kids. I've been working with kids for years. And I think that that fear of data, you have to meet it where it lives, and it lives embedded in a fear that somehow it's going to be misused, that it's going to be make their courts look bad, make them look bad, have some kind of false competition developed either between courts or within a bench, worst case. Or also, worst case, since most of us in the United States, most judges are elected, the trial courts anyway, a fear that somehow it's going to come back and be used against them. I think that we have gone beyond that because we are such a data-rich state, but we are also now a data-driven country in many respects. And it started with our legislature for us in the state of Washington in the late 90s. The legislature said, look, here's what evidence-based practices are. It isn't anecdotal. It doesn't necessarily have to challenge your given beliefs about what works, but it's worth looking at. And we believe that it's worth looking at because it's the most effective use of our dollar. And we're going to go one step more, and we're going to say, because we believe this, we're going to incentivize local courts to use evidence-based practices, because we're going to give you money to use evidence-based practices, and we're not necessarily going to give you money to have other programs or projects that you may hold dear and you may love, but we're just not going to give you the money to fund them. So if you can find the money independently, that's fine. Well, of course, that's not true. So that's the stick and the carrot, if you will. But more to the philosophy of judging, I think, ways that have engaged judges to not only suffer data, but to embrace it and use it pragmatically and proactively, is that without a doubt, judges who come to the bench are not interested, probably 100%, in being mean to kids. And I think that's true for most professionals working with juveniles. They're not trying to make mistakes or make things worse for kids. But judges in particular are motivated by the idea of being effective. Are you really making a difference, or are you part of a structure which is a revolving door? God forbid it being ineffective, being ineffectual is just is something that judges certainly don't want to be. So if you can demonstrate with the use of data that they can in fact be more effective, I think that is a key.
Justice,
And one other thing, I'm sorry, but one other thing is the extent to which, again, on that very personal, visceral level, would you rather sit in a court day after day, being a part of this revolving door and knowing that you're not making a difference or being pretty sure, or having a higher level of satisfaction and actually seeing problems solved? And of course the answer is yes, I would rather do that, which has also been illustrated in the greater use of problem-solving courts and judges ceding their sole decision-making to team decision-making because they know it's more effective and it makes them feel personally more satisfied in the work they're doing. So that's some of the ways to get about this.
Justice, when we saw the chart where we talked about the different kinds of outcomes for kids, we showed that those kids who were getting no intervention doing about the same as those kids who were going into programs.
That's the scariest statistic in the world.
You know, you talk about justices who really are inclined to help and want to help. What do you do for those situations? I mean, one of the things that we showed was increasing numbers of low-risk kids being put under supervision and being placed in programs that weren't necessarily the right fit. So how do you reconcile those good intentions that you described earlier that a judge has with the placement in some of these programs that may not be the right fit? How do you explain that?
Well, I think there's two things. The short answer is we need deeper dives in that data, and we've done it for example, in the state of Washington with racial and ethnic disproportionality. You know, how is it that we've reduced the number of kids in detention, for example, and yet we've increased the racial disparity of the populations that are in detention. And what we're now doing is taking deeper dives, looking at every single point of the process to see where is it shifting, where is it not working as effectively as it might work. But the other thing I think on this net widening or ineffectiveness is a responsibility of the court to, again, look at themselves as an institution, but to judge where the buck stops in the individual courtroom and say, I should cede authority here. This is not necessarily where the kid belongs. And in our work in status offenders during the Models for Change years, that was a significant part of what we were attempting to do, was to indicate that sometimes keeping out of court is the best way to resolve an issue, particularly with low-level offenders, diversion, which we've used for a lot, but with status offenders, to try to, I won't say rid ourselves of our impulse to do good, but to direct it
Right.
and direct that by ceding authority elsewhere, so that the court becomes the place of last resort for kids. But there is still a role for the court to maybe supervise, and let's strike that word supervise, to hold others accountable
Right.
for doing their jobs. And that's the best job that we can do.
We're going to ask 2 more questions, then we're going to open it up for questions for you. So be thinking about those in case you want to come up to a microphone and ask a panelist about an issue you're facing. But an interesting point, Justice, about people who want to help and telling them that not necessarily their first instinct, the way you can help is to actually take a step back in some ways. Interesting point. Back to our juvenile justice directors, one of the things we don't want people to come away with the impression of is that these programs don't work, right? In fact, the evidence shows quite convincingly that the right person in the right program can have a huge impact. And I know, Director Burke, you've been talking about actually applying evidence-based practices, right? And we find time and time again the program that says, yes, we believe in, we're going to apply MST, but we actually can't afford the clinician 3 times a week, so they'll only meet with them once a week or something, right? And then that's no longer the actual model. So I guess the question is, can you give some other examples of the gap between what the evidence actually is and then how it actually sort of gets applied in a piecemeal fashion in your state?
Sure, I'll talk specifically about our own agency. For the last 10 years, the state of Utah has been using a validated risk and needs assessment tool. And we were very proud of the fact that we have been practicing evidence-based practices for over a decade. And we had all of that information being funneled into our case planning process, and we were very proud of the fact that Utah is ahead. We keep hearing evidence-based practices. You need to start with that validated risk and needs assessment. You need to apply it. You need to then do service matching. But one of the things that we found is we weren't connecting the service matching and then evaluating whether the kids were being matched with the appropriate level of service. One way that we have been working to address it is utilizing the correctional program checklist. Because when we talk about evidence-based practices, you have the gold standard of evidence-based practices where you have the control groups, and none of us really have the ability to be able to implement all of those gold standard programs. And so we want to be able to also allow some creativity and also some individualization of our programs. So through the correctional program checklist and working with providers and providing them ongoing technical assistance, we are seeing improvements in the quality of service that's being provided. We have yet to see whether recidivism rates are changing, because you have to have that period of time to give programs opportunities to make those changes. They used to go through the programs, and then that period of time when they're out in the community. But that's one approach that we've taken to try and address that particular gap.
Perfect. It's a great example. Thank you. So, Representative Tilley, if you don't mind, I'm just going to put you on the hot seat for a minute. We're going to do a little bit of a role play. I know you sort of deal with this routinely, but we work with a lot of people at the agency side who say, we've tried to tell this provider what they need to be doing. We've told them this is evidence-based practices. They are convinced that the program they have is great. They're not getting the outcomes we want. Time for some accountability. And the legislator says, right on, and says, that program happens to be Safe Kids Rainbows program. And We know that you often speak at their graduation ceremonies, that you're a huge champion of Safe Rainbows Kids program. In fact, we know that somebody held a function for you the other night, and when they were, you've been a terrific champion of their program. It's time to shut it down, Representative. That's a tough discussion that we hear about in many different states. Can you give some folks some advice as to sort of the dynamics of those conversations and how to work through them?
If you want to stay elected, never shut a program down called Save Kids and Rainbows. That's the first thing I say. I've got 3 little girls. I couldn't even go home if I did that.
Throw in ponies instead.
Wow, this is the hot seat, Mike. I thought I was going to be able to get out of this one, but if the question is how do you go about that, I think first of all you got to show them, number one, it doesn't work. Your best intentions, that's great. You applaud that effort and say, let's redirect that effort. You want a program to work, right? And so let's redirect our efforts to one that does. We can still call it Save Kids and Rainbows as well, but we need to change the infrastructure underneath it. So I think that's the first thing you do. I think you build a consensus before you go to that board of people on both sides of the aisle to back you a little bit. If it's not your leadership, but at least your colleagues in the other committee that will hear the bill. If it requires legislation to deal with it, to maybe push funding in another direction. And then you might subtly say to someone who can provide some leadership in that organization, I don't want to shut down this program for any other reason, but we need to find something that works. But if we can't do it, if you can't join me in this to try to build some consensus, then you may find yourself without funding. And I think, and you could play good cop, bad cop for that reason. I mean, you can point to the big bad A&R committee that wants to use evidence-based practices that work in funding these things. So I think you can use that approach. It's doable. I think it can be done.
Great. I'm going to invite people to come up and ask questions to the microphone. But Director Jones, I know that's the real life situation of a director of a juvenile justice system. Any response to Representative Tilley's points or advice for folks in the room?
I mean, I feel like juvenile justice reform it's a marathon, not a sprint, right? So much of what we're talking about here is follow through. An evidence-based program that doesn't have fidelity isn't helping. Legislative reform poorly implemented fails. A juvenile justice system that reduces its population but still has a 70% recidivism rate fails. It's like a good golf swing. You got to follow through. Like we all just have to sign up to stay in it because it's a marathon, not a sprint. You got to go to that program and say, programs don't just work, they are work, and you got to keep working on them.
Well said. Representative Tony Walker is the chair of the Appropriations Committee in Connecticut. Representative Walker.
Good afternoon, or good morning, and thank you all. Thank you, Mike. This is great. I'm going to go to the contracting and the big agency versus the small agency. This is a struggle that I think all of us have, because you can have mega agencies that have incredible grant writers and people that can play the languages, but they don't have the ground support in the communities that you need to have getting the services.
Right.
And this is a struggle we go with, and I think a lot of us legislators have talked to many of the agencies about this. And how do you get the movement to understand, no, those smaller grassroots agencies don't have the sophistication to do the paperwork, but yet they have the strength to make the change within the community because they look just like the people they serve.
Right.
How do you get that conversation to be much more robust and honest, so that when I talk to agencies and I say to them, why didn't you give this agency a chance? And they say, well, when we had the criteria and we had all these numbers and they didn't qualify under any of the guidelines that we use, but they educate and support and employ the people that live next door to the people we have to help. So how do we work on that?
For me, I think that's a great point. It's an honest point because I think it's happening in jurisdictions. And basically the point at it is, okay, if we love evidence-based practices, and I think we do, but we can all admit, and we should, that we have not figured out all of them yet, right? There's still some room for innovation. And so how do you seed and support promising practices? But the name of the game, I think, for everyone, especially for representatives and legislators, it's rigor, right? It's both saying, okay, we have to be willing to fund and support innovation, and support new programs to come up. We have to help them with the grant writing. We have to support them to have a researcher and a data person. But we also have to be willing to hold them accountable to this idea that I love a community-based program where people trust and feel good about them, but I'm not going to trust your gut any more than I'm going to trust the gut of that shop. You also, before you get that randomized controlled trial expensive report that says you're in evidence-based practice, could be producing data and working with a local university to allow research reports to show that there's something promising here. So it's like there's something on that scale of rigor and promising before we get to evidence-based, and everybody's got to be willing to do that.
I agree with you, and I'll tell you one thing. In Connecticut, everybody knows I hate the word evidence-based.
Yeah.
Because the fidelity of it changes with each community. And when sometimes, I know one example was there was a program that had MST that they were using in a Latino community, but they had no one that spoke Spanish.
That's a fidelity issue, right? It's the follow-through.
Yeah.
So, Director Burke, I would love your response to this too. And I know the other issue, if you wouldn't mind addressing, is that we hear that the state just drops the hammer on us. All they do is they tell us what the requirements are, why we're not meeting them. You know, what about the fact that, you know, these are people who there's a lot of turnover in our agencies. You know, we can't afford, really experienced personnel. Where are you to help train and actually help our providers succeed, other than just simply hold them accountable? What's the role of the state in that regard?
Well, once we award a contract, we have an obligation to help them be successful. And we have partnered with our local university to provide that on-site technical assistance. And we make that a part of the contract requirements, is that you will participate in this particular process. But another thing I want to add about the challenges with awarding contracts is that we also have to look at our own state laws and purchasing and procurement codes, because a lot of those laws prohibit us from having any conversation with potential providers. So we're saying that we want to have these excellent programs and services, but we can't talk to you about what kinds of programs and services and how you need to structure those programs and services in order to be effective. So you're going to have exactly what she described, is you will have the programs that have a lot of resources that are going to do really well, but the programs who have a lot to offer won't be competitive because we're just prohibited from having those conversations. So I think we need to look at purchasing codes in our state. This is a human service type of program. We're not purchasing widgets. We're not purchasing products. We're purchasing services to change people's lives.
So we got two other questions, but first, two comments from Justice Bridge and then Representative Tilley.
Yeah, I just wanted to add that the state of Washington several years ago, and I certainly don't remember the bill number, but passed a legislation which not only authorizes but mandated the Institute for Evidence-Based Practices in Juvenile Justice, that's more or less the title, at the University of Washington, to work together with others in the field, including the Washington State Institute for Public Policy, which is a independent, though an arm of the legislature, to do an analysis of programs around the state which were current contractees of the for juvenile justice services and child welfare services, and see what were evidence-based, how they were working, could they be identified as promising practices, et cetera. And that particular process is to be updated every twice a year, so every 6 months, giving local programs an opportunity to come before this group, demonstrate what they're doing, be analyzed, and somewhere on a grid identified as too little data being collected to tell, all the way up through, yes, they're meeting evidence-based practices, fidelity to the model, and ensuring that there will be resources appended to these smaller groups to help them make their way up the chain, if you will, so that they can be more competitive for contracting statewide.
Great example. Thank you, Representative Tilley.
Just briefly, under the implementation heading, I think training is probably the most critical thing. I was talking again to Ms. Dudgeon and Justice Mary Noble, who's with us, and they wanted for me to reiterate that point over again. And we couldn't do it in a state. Most states are strapped with educating, medicating, and incarcerating, so we don't have a lot of leftover money to train for a new bill. It just doesn't come. So OJJDP, thank you again. CJI, Pew. Not only did they help us on the front end, but they're helping us now on the back end with our implementation efforts. And if we couldn't train our folks on the ground like we're doing now, I don't think we could implement the bill. It's just that simple.
Yeah.
I want to go back to the question about procurement laws that Susan Burke raised. Do you think there's any potential for taking a look at that, or is that just a whole can of worms, Representative?
From what end? I thought the question was for Susan. I'm sorry. I completely relaxed and was so proud of myself for that answer that I didn't hear your question. So, is it possible for what, Mike? Again, tell me.
Sorry, sir. The procurement
laws.
Director Burke raised the issue that would really love to talk to providers about how to approach the contracts, but that's going to often require a conversation before a contract is awarded. And that's prohibited by state law because of procurement laws. So I figured we'd talk to the lawmaker here and say, well, why don't we take a look at some of the procurement laws and how that goes?
I think that's actually possible. Again, politics is the art of the doable. I think in procurement in our state, like in many other states, there's so many ethical questions that are just so. I think the public is very receptive to a discussion and legislation to make the process one, more transparent, two, more ethical, just more fair. We still have. With all our efforts, and I know Texas and Kentucky have been lauded for some transparency lately, but for all that, we still have holes and loopholes which allow, as far as I'm concerned, unethical things to happen. There's bid rigging. They're fashioning these the bids to suit one particular bidder, and that happens all the time. So I think the public is ready for that conversation at any moment.
Great, thanks. Chief Jenkins, San Diego Probation Chief.
My colleague was waiting, though.
Oh, I'm sorry, I missed you. Go ahead, sir.
That's okay. I'm John Clayton from the state of Washington. Judge Bridges from me. She's the person that I sort of patterned myself after if I want to do something good. So, but I do want to bring up a few things that I would say lessons learned if you're looking at evidence-based program. Number one, don't just have a design and not collect the outcomes to make sure that you're getting those outcomes that you can measure. In the state of Washington, we have a great design. Some of the programs that you mentioned, we're sort of the drive a shiny red car. But when you raise the hood, what you see is some outcomes that we need to work on. Recidivism rate is still very high. It's actually at 58%. So make sure that, and we don't manage enough of that. So we're starting to do that, and we're doing that through different processes that we utilize. Number two, when we started the program, we actually closed out a lot of the minority communities by closing some of their programs because they weren't evidence-based. If you look at the rate of recidivism rate for youth of color, it's considerably higher than other youth in the system. So you have to ask yourself, is there a correlation between closing out those programs and actually high recidivism rate? So those are two things I would be very careful about if you actually put those programs in place.
Well said, thank you. Any responses from the panel? No? Chief Jenkins?
Okay, thanks, Mike. Great panel, great conversation. I have a question. Actually, I also want to say, Susan, I agree with you 100% on what you said about procurement laws. You know, I won't go into that right now, but I think you're right on point in terms of looking at that. It's trying to move some things forward. But my question is for Susan, and as a friend and colleague, it'll be a softball, but I want you to
Thank you, Mac.
just to hear a little bit more about, because you made reference to using the correctional programming checklist. And I want to hear a little bit more about your experience on that, because we're doing that in my jurisdiction, in San Diego County, where we've engaged, obviously, with community providers, engaged with the court and my department about, on the issue of fidelity of services that are being delivered to the population that we serve, we certainly want to know that those providers are using practices that work. But we have run into a less than open arms in terms of reception from some of the providers in terms of using the checklist. So I'm kind of curious about what your experience has been and how you've kind of navigated through that.
And can you just start by just giving a little bit more of an overview or background of the checklist for folks in the audience?
All right. The correctional program checklist was actually developed out of the University of Cincinnati, and we have
Featured
Dr.
speaker at the
Ed
next session.
Latessa here, so he can probably give more information. But it's based on the premise that evidence-based practices, there are certain characteristics that demonstrate evidence-based practices and programs, such as having a program manual, for example, would be one foundational piece of a strong program has a particular manual. So the correctional program checklist is a process where you go to the program, you observe the groups, you observe their intervention practices, you sit with their management, with their staff, you look at their policies, you look at their practices, you look at their curriculum, and utilizing the guidelines in the checklist that was developed and pulled from a whole body of research that shows these characteristics are present in programs that show reduced recidivism for adults and youth. And when I was working at the courts over 10 years ago, we wanted to know, were the probation programs that we were sending kids to, the intervention programs, were they effective? So we started implementing the correctional program checklist. And how we approached is that we brought the programs in and said, we are here to help you improve. That is our whole intent with the program. But we also, in all honesty, told them, if after this rigorous effort, if after a couple of years you're still demonstrating no improvement whatsoever, then we're going to have to make those tough decisions. We're going to have to say, you know, the Rainbow program, sorry, you're out. And we did that with one program.
Yeah,
but
good
then
luck
we were
with that.
able to reinvest. But we had a couple years of research and effort and practice to show this program is not improving at all, and it is showing that it's ineffective. So we've done the same thing in our juvenile justice system, in our correctional arm, implementing the correctional program checklist. We now write it into the contracts. They know ahead of time that it's a requirement, but we're there to assist them and support them. And that's the whole goal, is if you take the positive approach that we want you to succeed, and they're willing to engage in that difficult discussion, then you're going to have some good outcomes.
I appreciate that. Just one little add-on, Mike, if I may, because we didn't do quite the same setup, and some of the programs that we've evaluated are not my contracts. They're contracted through our healthcare agency. So part of the response that we got from some of the programs was, it's too much time for us to go through this correctional programming checklist. That wasn't in our original agreement. That wasn't in our contract. How are we going to be compensated, and things like that. So we've started to have the conversation, too, about writing it into future statements of work. So appreciate your thoughts on it.
And if I can ask a follow-up question on the chief's question, we've heard a lot of just concerns that, well, that's a checklist that's a national checklist that just doesn't really appreciate sort of the nuance of our particular program. So how do you explain this to somebody in a way that doesn't feel like cookie cutter-ish? What's the discussion that you have with those program administrators?
Well, we sit down and brief them specifically on how the tool was developed, how it's been used across the country in a variety of different programs. We talk about our prior experience with utilizing the program, and we also demonstrate for them that here is program X that went through the particular process, and here you can see that over the course of 3 years, program X has seen some incremental improvements in their outcomes. And so we just have to sit there and have that discussion with them and be really frank and transparent about that process.
God, thank you. Steve?
I have an uncharacteristically brief question to Emeritus Justice Bridge. Are your judges elected or appointed?
Elected.
Well, I have a follow-up. Have they had any blowback in their elections as a result of what they've been doing with teams, et cetera?
No.
Good. Thanks.
Uncharacteristically brief both directions.
One of the questions I want to ask the panel is that we saw that with the declines in the state population, a leveling off of the use of some of the local facilities, that in fact, I think one of the things that's become so interesting is that we've seen fewer and fewer kids in state-run juvenile correctional facilities. We now see today the majority of kids in locally run facilities or privately run facilities. This is an everyday reality, I know, for you, Director Burke and Director Jones. To what extent do you think legislators are understanding that this is now a real sort of a hodgepodge quilt, you know, of different kinds of organizations running these things, and you don't actually run all of these different facilities that are out there? Is that something that a lot of people fully are appreciating and understanding, or has that been somewhat of an education recently?
I think it's an education process. The last panel, someone talked about, having conversations with people, and they're saying they're sort of conflating probation and parole. It happens to me. The point just made about in San Diego, there's a really popular program that we have in Illinois that is sort of a pretrial intervention, and people ask me all the time, how are we doing there? And I'm like, I'm sure we're doing great, except I don't run that program, so I really can't speak to it. But I think, it's sort of, this again is sort of the issue of just, it puts the onus on us to just pound the pavement a little bit. A lot of what we've tried to do is get out there, and while we're holding all these different providers and entities accountable, we have to hold ourselves accountable both for owning the narrative and producing some follow through, because part of the confusion is because sometimes as administrators we're afraid of our own shadow and don't want to be out front nurturing those relationships, talking about what we do, what we don't do, and the challenges around it.
Director Burke, any further comments on that point?
Nothing additional to add.